Hello and welcome everyone. So good to have all of you back into another All Stars live session. So please let me know if you're able to listen to me and watch this. So good morning, good afternoon, good evening, wherever you are from. Let me know where you're joining from, whether you're from India or another country. I'd be happy to know all about you and what profession you are and all those things. So, hey, hello, Kenneth. Hey, Vandana. Yes. So today we have a lineup of a lot of common questions. Niveda, hello. Cynthia, hi. Priya, hi, Priya. You're from, Justin is from Taiwan. Suresh, hello. Yes, Vandana, sure. Nana, Harita. Hey, Harita, good to see you. Justin, Surab, Beena, Asha from Kerala. Nana is a nurse from Ghana. Welcome. Cynthia is from Zimbabwe. Subida, yes. Beena from Bahrain. Pragya from India. Good to see all of you from different parts of the world. And hats off to all of you who are healthcare professionals. Subida from Kerala. Noemi from the Philippines. Sebin, hello Sebin, he's from Maldives. Great. Nivedita is from Tamil Nadu. Excellent. Chitra from India, yes. Hello Monish. Good to see us always. Jane. Yeah. Darla from the Philippines, yes. Maria as well from the Philippines. Asha is a nurse. Welcome everyone, and Suresh is from Karnataka. I'm good. Tagaram, I'm good. Thank you very much. Shoji from the Kingdom of Saudi Arabia. Purpa from Nepal. Good. So the beautiful country, the mountain-locked country of Nepal. Amarpuri is from India, yes. Shella from the Philippines. Rachel from Dubai. Ahmad from Turkey. Bino is from Trivandrum. Good. Lovely city. Okay. Abis is from Kerala as well. Right. Priscilla is from Zimbabwe. Okay. Great. So keep sending in your messages and I'll do check. Hi from Taiwan. Shilpa. Hello, Shilpa. Mia from Philippines. Muskan from Saudi Arabia. Welcome everyone. So today we are going to deal with a lot of do's and don'ts, and this is your chance to ask questions. Oftentimes, when I've been doing sessions, especially on clinical criteria of speaking, I have not been able to answer all the questions. Hello from Iraq. Good to see Siddharth from Chennai. Great. So today we are going to do a lot of questions. Al-Hasna from Sudan. Chokrane from Algeria. Very good to see all of you. Okay. So Hima from Kollam. Hello, Sanunath. So please type in your questions on speaking, and I've divided it into different topics. And as we go, I'll take a few questions, and then I have prepared some previous questions. I prepared a few slides based on some of your own previous questions, or questions which I've been asked by my own candidates a lot of times. So we'll discuss that as well. Said, I'm sorry I didn't read your comment. I'm really sorry. The problem is that a lot of comments sometimes pass by very quickly. My apologies. Right. And Elia, Leonardo, welcome everyone. Hello, Vinci, Jeppe, Elia. I'm afraid I don't understand the language. It's all right. So now, to begin with, I want you to focus on questions about your skill development of speaking. So if you have any questions on how can I improve my speaking, Philippines, all right. Thank you for correcting. Okay, Rajkumar has the first question. If I repeatedly use some words, does that affect your score? Thank you for that question, Rajkumar. Well, if you use the same word repeatedly, it's not a good idea, basically. But I must say, sometimes you will have to repeat the same word if it is something that conveys the precise meaning. Now, what I mean by that is, of course, it's a good idea to use paraphrase other words to convey a different, show that your vocabulary without changing the meaning. Now, I'd use an example to illustrate that. Let's say you're talking to a patient, and I think I've discussed this earlier as well. You're talking about restricted mobility, okay? And so if you think of some other words, let's say limited mobility. Now, as a healthcare professional, it has different meanings. So that's not a good idea. So in such scenarios, you'll have to use the same words. But if you can, use words which will fit in, which expands your range of vocabulary, that's fine. You don't have to bother too much about that, honestly. Right. So I hope that's clear. And I've got Rajkumar, yes. Bees is asking if you speak very fast, whether it will affect the score. Let me tell you, if you are speaking very fast, perhaps the listener may not be able to understand what you're saying. So it comes, it might affect the fluency a little bit. Now, when you think of fluency, a lot of people might have a thought that it's about speaking too fast, which it is not. It is the ability to speak at a constant pace. I agree. So that's not too fast. Now, a lot of candidates might be a little bit stressed because of the test. And if you're stressed, you tend to speed up. So that's something which you have to be very careful about. And the pace should be varied depending on what you are doing. So if you are, for instance, explaining something, you may have to slow down so that the patient understands what you are trying to explain. Otherwise, it's not going to be really productive and effective. So remember this. It's not about being too fast. You're not required to cover a lot of sentences in speaking. Speak in a natural pace. That's fine. I hope that addresses your question, Abis. Hello, Mona Hamid from Sudan. Manpreet, you have a test today. Fantastic. So relax and take your speaking test. It's going to be great. Think of how you would perform in a natural setting, Manpreet, and that's going to be very helpful. So relax and speak in a slow pace, a normal, natural pace. Niveda is asking how long to take intermediate to practice speaking skills. Well, can you explain that a little bit, Niveda? I don't get it. Roshni is asking, in case of a known patient, do we need to introduce ourselves? All right, I'll come to it. Yeah. Hey from Egypt, from Vijay from Chennai. Yeah. If Subita is asking if the time is up, do you have to, are you going to be stopped, I suppose? Yes, I'll come to it in a moment. Rajkumar says the interlocutor asked you to stop speaking. So if you stop without a conclusion, I'll explain that in a moment. Mediko is asking for grammatical, mistakes. How much marks get deducted? All right, because it's part of one of the criterion. So you have to go through all the criteria, and so if you make a lot of grammar mistakes, it will reduce your marks in the area of grammatical range. Okay, so I'll take. Do we need to convey accurate medical knowledge during speaking? I mean, not really. No. Having said that, as healthcare professionals, you should have some idea. And if you totally go wrong in understanding or explaining medical concepts, that might be a problem. But for instance, you have a patient with arthritis, and then you tell this is something which affects the brain, you're totally off topic, and that is not an ideal situation. Otherwise, it's all right. It doesn't have to be too precise. Sorry. Okay, so this is excellent. Keep posting the questions, but for a few minutes, I'm going to spend some time on the topic we have on the screen. How can you develop speaking skills? Now, I have a few random thoughts for you, which will really help you to improve your language. Try to think in English. So if English is not your mother tongue, your native language, which could be the most probable factor for most of you attending this session, and most candidates who would like to sit for the OET, it could be that you think in your native language, in your mother tongue. So try to think in English, because it will help you to be more efficient in the process of, thought being converted to speech. And don't try to translate. A lot of time and effort will be wasted when you do that. So that's one skill which I want you to hone. And speak a lot. That's something you can do to improve your speaking skills. So you can speak to somebody, a friend, a colleague, a family member, that's fine. If you cannot find anyone, speak to yourself. Self-talk is something which you can try. You can speak in a mirror. Mirror practice is suggested a lot. It will help you to gain confidence. And so the more you speak, the better. Okay. Listen. To improve your speaking, if you can listen, that's good. So listen to others speaking English. And you can listen to native speakers. Now, if you don't have native speakers around you or where you live, you can go online on YouTube, find authentic listening recordings or podcasts of native speakers, and you can try a variety of accents. So try listening to somebody from the UK, from Australia, from America, from Canada, so that you get exposed to a variety of English accents. And that will help you to improve your speaking. It will help you to perfect your pronunciation, and it will also help you even later in your listening as well. So that's something which you can try. And I spoke about speaking to yourself, but you can also listen to yourself, which is again a great thing. And if you have some practice listening tests, if you listen to the consultation in part A, that's going to help you in your speaking as well. So Very good, Shahzad. She's trying to improve or reduce her translation. Fantastic. So you can watch OET's official role plays on OET's YouTube page, Facebook page. IRS Group has some role plays on our Facebook page and YouTube page, or watch quality material, quality content, even by other premium preparation providers. So they would have spent a lot of time in making sure that those are high quality videos. So that's another way of improving your speaking skills, especially for OET. And try to build a repertoire of words, phrases, and collocations. So if the term collocation is new to you, it's the pairing of words. So we say a caregiver rather than a care provider. Caregiver suits better. So that pairing is what is a collocation. So learning words in phrases or as collocations in pairs that suit well, that go together, would be a good idea. You can have a collection of questions as well, which you can use in various settings. However, I've got a warning for you: do not memorize. When you memorize questions or statements or whatever, it might not come out well in the test. And examiners are trained to identify patches of memorized text. So avoid memorizing it. It will not work out the way you may plan. It may not sound good. So what's more important is natural speaking. So building a repertoire is all right, but don't memorize it a lot. I know a lot of questions are coming in. Sanu is asking, can you use US English? Absolutely, yes. OET accepts all the variations of English language. Now, a lot of candidates might think you may have to develop a particular accent. No, all that's important is developing a neutral accent. It should be intelligible. You don't have to put on a fake accent or sound like a British or like an American. It's not required. But depending on where you plan to work, when you move to that country and work there for a couple of years, perhaps you will get used to that accent and you might start speaking in that accent as well. That's all right, because accent is regional, it's cultural. Yeah. So that's something about speaking skills, or how you can improve your speaking skills. Now, if you have any questions on scoring, it's the time for that, but I'll go back and visit all the questions which you had posted earlier as well. Regina is asking, during preparation, is it all right to write short sentences on role play card? I'd personally suggest it's better to take some notes rather than write short sentences, because when you are doing the role play a bit later, you will have to read that entire sentence and you'll be focusing on reading it rather than interacting with the interlocutor. So that's not a good idea. Okay. Now, a question I hear a lot is, how can I score 350 marks if that's your required score? Now, everyone's a bit worried. Can I achieve my required score? So I'd suggest speak proficiently and develop an awareness of the criteria. So if you would like to go through the criteria in detail, if you have not been taught, go to OET's website, occupationalenglish.test.org, and download the criteria sheet. So you will get to know, to understand a lot about the criteria from the descriptors. And the sessions I do have been focusing on clinical criteria, clinical communication criteria. Some other colleagues who are premium providers do sessions on linguistic criteria. So watch all those recordings to understand the criteria better, and you'll be able to apply those aspects of the criteria. And that's going to help you to develop a better score. So work on your language skill, let your natural ability to speak English go up, and apply different aspects of the criteria, so that the combined effect is going to be really, really helpful. Okay, so in the criteria, you can explore the marks given to individual criterion, and so how much it's going to affect. So for instance, if you someone was asking about grammar, so you will see a lot of descriptors. If this is what you do, this is the marks you will achieve. So if you need six band, this is how you have to do. So that is something which you can explore later. Okay, so let's now move on to another topic. Some of you have been asking questions on timing. Let me just see if I could get back to your questions. So type your questions about timing. Okay. Cabinet says it's difficult to talk 5 minutes. Okay. Right. And Chitra is asking what I need to do to finish my task within 5 minutes. It's hard for you. All right. So for both of you, practice with someone, and typically when you practice, you'll develop an awareness of how much time you have spent, and how much time is remaining. A rough assumption. It doesn't have to be precise. You don't have to bother too much about completing the task. So I'll come to it a bit later, but since I've seen that question, I think it's very important, and a lot of you might have that on your mind. Imagine there are 5 bullets, 5 tasks in the role play. You are on the 4th task, and then the interlocutor says, your time's up. So if you have produced enough language, that's perfect. Having said that, if you are still on, let's say, the 2nd bullet, and you went on and on, that's not a good sign. I hope that explains your question. Okay, so I've been asked previously about the timing. So the speaking subtest takes about 20 minutes. So you have 2 role plays to do and the warm-up. So that's how it comes to roughly 20 minutes. Okay. Now moving on. Okay, someone asked, is there a break between the role plays? No, you don't have a break between the role plays. Once the first role play is over, the interlocutor will collect the role play card and hand the next role play card over to you. So you don't have a break technically, but you get the next 3 minutes of preparation time, which you can again use to prepare the next role play. So that's kind of a break, because you get that slot of preparation and not having to speak. In that sense, yeah, but technically you don't have a break in between. Okay. Now you can shoot all your questions about the interlocutor, because a lot of candidates have concerns about the interlocutor. Now, to begin with, let me tell you, you don't have to be worried about the interlocutor. The interlocutor is like a friend. Do not look at the interlocutor as if like this person is gonna judge me. No, he or she is going to guide you with the test and help you to speak better by being your patient or carer. So that should, the interlocutor should help you to relax. Okay. So can I ask something to the interlocutor? Yes, you can ask a few things to the interlocutor. Now, remember, the interlocutor runs the test and takes up the role of the patient or the carer. So there is that dual task that the interlocutor plays. You can ask questions to clarify something that you don't understand. That's all right. But remember, you have to do that during the preparation time. Okay, I hope that's clear. Can I ask the interlocutor to explain a medical term? Yes, you can. So if the term you're asking is something which is related to the role play card, the interlocutor would have been, given some training or an awareness of what the topic is, and so they would be able to help you with that. I see a lot of questions. Diana is asking something related. What if the interlocutor doesn't respond appropriately? Keep speaking, number one. Now, you may not be aware of what is on the interlocutor's card. The card that they have with them is different from the card that you have. So it could be that one of their tasks is to be reluctant to listen or be hesitant to respond. It's your task to produce speech to persuade the patient or the carer to respond. So it's actually testing your ability to handle a slightly tougher situation. All right. So and the examiners will listen to what you say. So I don't strongly believe that all interlocutors will not respond. They will respond. They might be waiting for you to persuade them to speak up. For instance, you can say, like, I know you're a little bit upset about what happened overnight, and I'm really sorry that you are in pain. But I would appreciate if you will tell me how you feel right now, because I'll be able to help you better. Something of that sort. So probably after nudging a bit, they will respond. Okay, so the question that I have on the slide is, will asking the interlocutor for clarification reduce your scores? No, it will not reduce your scores. So you can ask them to explain or clarify something that you don't understand. That's perfectly fine. Okay. I'll try to come back to all the questions that you have asked, perhaps after covering a few slides. Is the interlocutor marking me? No. Marks will be given by trained assessors in Melbourne. They listen to the recording, and that's when you'll get the marks. So the interlocutors don't mark you. They'll just listen. Help you with the role play and be your patient or the carer. I hope that's clear. Okay, someone has asked, will the interlocutor be a healthcare professional? Interlocutors are trained to do the role play. Typically, they could be having an English training background or the ability to conduct the test as deemed by OET. So it's not necessary that they have any healthcare background. That's not required. There might be some interlocutors who have a healthcare background. But don't expect that everyone has. That's not required either. Excellent. Now an interesting topic is the warm-up. So Mary is asking how many SSS are scoring? 2 SSS. Typically it's 2 SSS. If you have any questions on the warm-up, please ask now. So you see a few people warming up before, I think it's a Qigong exercise, something like that, yeah. So it's the Chinese art of, I don't know. So, but they're warming up. So if you go to the gym or, if you work out, you'll do some warm up. Now, OET has a fantastic warm up as well, and it should help you to relax and get ready for the rest of the test. So, okay. So Manita is asking, do you have to ask the interlocutor's name during the preparation time? I'll come to that in a moment. In fact, we have some time for preparation time. What kind of questions are asked in the warm-up? So it's all general questions about you, your work. For instance, I have a few samples on the screen. Where are you from? What do you think makes a good nurse or a doctor or a pharmacist or a physiotherapist, etc.? Your profession. What are some changes you have seen in healthcare? Just some general questions about your work is what you're asked. So I'd say you don't have to be really, really worried about those questions. If you can answer normal questions that someone asks you when they meet you, then the warm-up is not going to be a difficult task. In fact, it should be a piece of cake. Okay, so is the warm-up assessed? No, it's not assessed. It helps you to relax and get used to the interlocutor. It will give you a head start. A head start is like, the confident gush of energy to do the rest of the task. So that's what a warm-up is. So don't be scared of the warm-up. Enjoy the warm-up. Be happy that you have a warm-up. Should I practice the warm-up part? No. Practice general conversations on personal or work-related topics. Do not memorize warm-up responses. Don't give a very stereotypical answers, cliches. For instance, I've interacted with a lot of nurses and doctors and everyone, but I'd just like to talk about a typical answer that nurses might give if you ask, what made you become a nurse? Now, a lot of people will say I was inspired by Florence Nightingale in a dream. Now, it doesn't sound natural to imagine that thousands of people have had dreams of Florence Nightingale. Give a little bit more natural answer to that. I wanted to work in the healthcare sector because it's a fantastic work and a well-paying job as well. Something of that sort is better than some memorized answers. So be natural, be honest with what you say. Okay. Um, can you use phrases to make patients understand better? Yes, Rani, you can use phrases. If you can give me an example, that would be helpful. Yes, India, it's recorded. Yes. And do you need to ask the interlocutor's name during the preparation time? Okay. So the interlocutor will introduce themselves with their name at the beginning of the test. So you already have their name, but it's absolutely okay, all right, to ask them the name during the preparation time. So that's fine. So we are going to the preparation time. If you have any other questions on the preparation time, type them now. Diana is asking, can you use idioms? You can use idiomatic expressions which might be natural and normal in that context. That's all right, but it depends on what idioms you're using. Somebody says they've been under the weather, and you can say, I know that you've been under the weather, and I'm sorry to hear that. It's fine. It's something which is used naturally in that context. Okay, so send in your questions on the preparation time. And in the meantime, I'll start with some of the questions which some candidates sent me earlier. So how can you make use of the preparation time? You have 3 minutes for each role play. Use it wisely. Take the time to analyze the role play. During the role play, so look at the setting. What is the setting? Read the background information, the background paragraph, which says you are seeing a 55-year-old person who is worried after surgery. So that will help you to understand the scenario, the setting, more in more detail. So what's the mood of the patient, and that will help you to prepare. And then go and read the tasks. So you may have a variety of tasks. Gather information, explain, reassure, persuade, all those things. So think of the various skills you may have to use during the role play. And this planning, if you have a meticulous planning done during the 3 minutes, your 5 minutes of speaking is going to be much better and relaxed, and you'll be confident because you have everything lined up, so to say. So that's how you can make better use of the preparation time. Don't waste time. Don't rush into speaking. Sometimes people may just quickly glance and then say you're ready for speaking. But honestly, I'd suggest take the entire 3 minutes to prepare. It might be better for you. Yeah. Now, we have covered this a bit earlier. What can you ask during the preparation time? You can ask clarification on pronunciation or meaning of terms. Yes, absolutely. You can't ask the interlocutor to show you how to do the task. They cannot do that. So that will not be done. Don't try your luck there. But you can ask, what does this mean? Or how do you pronounce this word? That's perfectly fine. Well, can you mark or underline on the card? Yes, you can. You can write, you can underline, you can do whatever you want on the card, and it will be collected back. Okay, so we are coming to some of the last slides, and I'll come back to all the questions which you have sent me in the chat. But we'll quickly look at some of the questions on the role play as well. So will the interlocutor start the role play? No, the interlocutor will not start the role play. You will have to start the role play. The interlocutor will not be starting the role play. So that's very important for you to realize. Yes, you should start the role play. Ideally, you could start by greeting the patient. Hello, John. My name is Milan, and I'm the nurse who's going to take care of you today. Yeah, something of that sort. Brilliant. Yeah, we have touched this a little bit. Will you lose marks if you don't complete the task? No. I've explained that a bit a while ago. If you're still somewhere towards the end, it's perfectly fine. And you would have spoken for 5 minutes, so the assessors have your language to be assessed. So when you have produced enough language, showcase the skills, that's brilliant. So missing one of the bullets or a little bit of information is absolutely fine. You don't have to panic about that. Okay, so I've been covering most of the questions which were sent in previously. Now you can ask me other questions, and I'll go through all the questions which you have asked from the beginning. I'll try to answer. Okay, Subhita asks, if the time is up, do they stop you? Yes, the interlocutor will tell you that your time's up. Again, yes, you are not able to conclude, that's all right. Okay. Tris is asking, could you cluster both tasks when tasks are too many? That question is not really clear, Tris, so could you explain that to me? Right. Purpa is asking if you mispronounce words or grammatical errors in sentences. Can you repeat it? So it must be whether you can correct. Yeah, it's all right to correct and go, but too much of self-correction is not very good either. Yeah. Okay. A lot of questions on finishing the task. Okay, right. Okay, in case of, Sarah is asking, in case of home visits, do you have to address the patient by name while entering the house? No, you're not doing the role of entering the house, etc. Knocking on the door or ringing the bell, you don't have to do any of it. It's just the beginning of the interaction with the patient. Home visits are typically with an appointment. Health professionals will not be making a random visit, a surprise visit, no. So it's absolutely fine to, if you know the patient, it's or you assume you know the patient and you call them by the name, that's perfectly fine. But if you if the role play specifies that you're going there for the first time, it's okay to ask their name as well. So, but if you are frequently visiting the patient, it's perfectly fine to treat the patient with familiarity. Okay. Thank you, Shirley. Yes, Siddharth is asking how to open a role play in case of a home visit for doctors, right? So it's almost the same for doctors or nurses or any other health professional. If you have any clues about a previous visit, then you can relate with that. So, hello, Lisa. Good to see you after a week. And I would like to check on how the wound is healing and also see how you are adhering to the medication, etc. So, something of that sort is fine. Authentic material for practice in all subtests. OIT has sample tests. OIT has books on the store. All the premium providers, including IRS Group, has authentic practice material. So as part of the premium preparation provider training, OIT has trained all premium providers like IRS Group on how to develop authentic practice material. So IRS Group has an app called IRS Learning. It's available on the Google Play Store, or if you use an Apple phone or something which is not Android, you can go online at irslearning.com. And when you subscribe to one of the courses, you will get authentic practice material. Okay, there's a question. Can't read the name, it's in another language, sorry. How interactions with my interlocutor counts? Well, the interaction with the interlocutor is what is being recorded, so it's important. Okay, Sharsad is asking, what should we do if you are not familiar with medical condition in the case notes? Let's say, okay, I'm talking about rosacea. So that's a reddish skin infection. And a lot of people, especially in the Western world, might have it. Now, if you are not familiar with the condition called rosacea, but when you look at the role play card, there will be clues or hints which will indicate that this is a dermatological condition. So you may find words like, let's say, itching, sunlight, topical application, etc. There will be hints and clues which will help you to identify the condition, and you don't have to be absolutely precise about it, as we discussed a while ago. So that will help you to navigate, to sail through the role play. Sorry. So look for such hints, clues, and guides. There would be examples given in brackets, and from all of that, you will be able to kind of relate to what condition it is. Shasad, I hope I've answered your question. And she's asking, is it okay to ask the patient to repeat? Absolutely. So if that's summarizing, or something called chunking and checking. So you give a chunk of information as part of information giving, and then you check back to see if your patient has understood, and that's perfectly fine. Hope that's what you have been asking. Srikuti is asking, how can you improve your pronunciation? Right. So you can attend classes on speaking where pronunciation would be taught. So your teacher will teach you about intonation, stress patterns, and so everything about prosody and all the different aspects of pronunciation, which is great. But you can also improve by listening as well. So there's something called immersion. So immersion is when you're surrounded by authentic language used, you have the ability to absorb it. So by listening as well, you will improve your pronunciation a bit. So perhaps a combination of both will be ideal. Anna is asking, I got 340 in 2 attempts. How can I improve to get 350? Now my personal piece of advice for all of you would be, just don't work to get a 350. Work for the highest possible band. Work for 400 or 450. The better your language skills are, the better you'll be in the test. And don't look at OET as a test which is a score to be achieved, but rather this is something which is training for your work, for being a proficient language user, being able to communicate well at workplace. So if you develop that kind of an attitude towards OET preparation, your mindset will change and you will not be limited by 350. You will want to achieve better scores. The sky will be the limit. And then you will be much more confident when you move to an English-speaking country where you can really, really communicate well. So Anna, look at achieving a very high score next time. Analyze what skills you require, what skills you need to improve. Nusrat is asking, oh yeah, I think I've addressed that, about the patient's name. Mary 2 SSS, yes. Yeah, Manita is asking, do you have to ask the interlocutor's name during the preparation time? You can. With names, you have a few options. So if the interlocutor name is, let's say, Tom, you can call your patient Tom, that's fine. If you want to ask the interlocutor what to call them during the role play, do that during the preparation time, that's fine. So during the 3 minutes of preparation time, ask your interlocutor, what do you want me to call you when you are the patient, when you become the patient? Equally acceptable. A third option is you want to call the patient, you want to name the patient Fred. Okay, hello Fred, that's fine. There's no hard and fast rule about what name to give the patient. It's absolutely fine. So don't be concerned about that. Mary, I suppose the average scores given by the 2 SSS will be taken. That's my understanding. Is it necessary to mention your full name during the introduction? It's not necessary, but typically workplace etiquette demands that we introduce ourselves in full. It's better, but you will never lose score just by introducing yourselves as like, hello, I'm Milan and I'm a nurse. That's perfectly fine. Perfectly fine. Vijay is asking if you can use medical terminology. It depends on what terminology it is. If you are telling a patient, it seems you have an angina, and the patient has no clue what angina is, it's not a good idea. So you'll have to explain what an angina is. You seem to have a chest pain, and it looks like it's radiating. That's fine. Speak lay language if that's what they understand. Too much of technical jargon will intimidate the patient. They'll be scared of the terminology. So I'd suggest there are certain terminology which are commonly understood by everyone, like let's say an MRI scan. That's fine. You can't make it layish. There's no lay equivalent for that. In such cases, you use the medical term. Amira is asking if I say some wrong medical information without purpose. So I suppose you accidentally make a mistake. So Amira, it depends on the gravity of the mistake. If it's a minor mistake, it's all right. If it doesn't impact the role play or the patient's understanding, that's fine. Because OET is a test of English and your medical knowledge will not be assessed. So that's something that the interlocutor may tell you. Gino is asking, if you don't understand the interlocutor's questions, can you ask again? Yeah, you can. So Vijay is asking, in speaking, is there a chance to fail? It depends on how the candidate performs. If you don't speak at all, then your score might be very low. Diana is asking, is it okay if we gather information together in the beginning itself? Well, the task might say, find out about something. So you can gather information about that. But you should, make sure to do it in bits rather than, tell me everything about the pain. You have to break it down into more questions, more open-ended questions. Joby, hello, Joby. Good to see you. Do you need to ask the interlocutor's name for each role play card? I think you can use the same name. That's perfectly fine. Right. Or name from your mind. That's fine as well. Like, remember I told about Fred a while ago. Vijay is asking, the interlocutors see English fluency or how reacting to fashion condition. Vijay, the criteria are divided into two. So you have linguistic criteria, which includes, the fluency you're talking about, among others. And then you have the clinical communication criteria. So both are important, and you need to balance both. So that's what will get you a higher score. You're welcome, Amarapali. Yes. Vijay is asking, after seeing cue card, no idea what you should do. I can't imagine such a scenario where you have no idea, because the tasks are very clear. Find out about the patient's problem. So you can ask, what can you do for them? How can you help the patient? Can you explain a little bit about the problem you're facing? So those are written in a way in which you can do the task. Niveta, yeah, to some extent, if you don't understand the condition, they can help you a little bit. No, if you ask questions, it will not affect. Manita is asking, can you use infection in the GI tract? If your patient understands what GI tract is, then it's all right. But otherwise, it's better to say what the gastrointestinal tract is, so that it's clearer to them. So providing better clarity is something you can aspire for. Nana is asking something about writing. I'm not answering questions on writing, but I'll try it anyway. Okay, so if you are writing to a specialist, imagine you're a doctor and you're writing to another doctor or a consultant, and if both of you know the term, then that can be written, because unlike speaking, you're not writing to the patient. But professions where you may write to lay people, you will have to use lay language, like a pharmacist. Excellent. So Okay. Seth, can you explain that? So thank you everyone for all the fantastic questions. And I hope I've helped you a little bit to understand the intricacies of speaking, and hope you'll apply these in your speaking practice as well as in the test. So hats off to all of you, the healthcare professionals from around the world who have joined me. Thank you, Vijay, and thank you, everyone. So IRS Group has got a lot of practice for you, whether you're a doctor or a nurse or any other health professional. And so please download our app and enjoy your learning. And I'll see you in the next session, but stay safe, keep working on your skills, and achieve fantastic scores in OET. So thank you, everyone. Thank you so much for taking part and sending all your questions. It was a fantastic time helping you with your questions, and with a lot of insights which I've been able to share with you. So thank you very much, everyone.